A first pregnancy is a wonderful journey, yet it often comes with confusion and anxiety. With countless pieces of information, advice, and even traditional taboos circulating, determining what is truly essential and necessary can be challenging. This article summarizes the most practical tips and advice based on medical recommendations and real-life experience to help first-time mothers confidently embrace a healthy, safe, and happy pregnancy. Comprehensive preparation, the foundation for a healthy pregnancy. Before conception or immediately upon learning the news, thorough preparation is the most critical first step. 1. Preconception checkup. This step is often overlooked but is extremely important. Purpose: to assess the mother's overall health, identify and treat any underlying issues, such as diabetes, thyroid conditions, or high blood pressure, before they can affect the fetus. Vaccinations. Complete necessary vaccinations like rubella, flu, and chickenpox, if not immune, at least 1 to 3 months before attempting to conceive. 2. Essential nutrient supplementation. Starting early is key. Folic acid, 400 to 611 mcg per day. Most crucially, supplement before conception and throughout the first trimester. Folic acid helps prevent serious neural tube defects in the fetus. Iron and calcium. Consult your doctor for appropriate dosages, especially iron, to prevent gestational anemia. 3. Adopting a healthy lifestyle. Eliminate bad habits. Absolutely avoid alcohol, smoking, and recreational drugs. Minimize caffeine intake, no more than 200 milliliters a day, equivalent to 1 small cup of coffee. Weight management. Maintain a healthy body weight. Being overweight or underweight can affect fertility and the course of the pregnancy. 2. The first trimester, months 1 to 3. The golden phase of formation. This is a delicate stage with many changes, focusing on protecting the developing fetus. 1. Initial prenatal visit and early monitoring. When to visit: immediately after missing a period or experiencing early signs of pregnancy. The first visit typically occurs around week 6 to 8 to confirm the location of the pregnancy in the uterus, hear the fetal heartbeat, and determine the estimated due date. Ultrasound and tests. Complete blood tests, urine tests, and early screening as instructed by your doctor to ensure the health of both mother and baby. 2. Managing morning sickness and fatigue. Nausea, vomiting, and fatigue are common symptoms. Eat small, frequent meals. Don't let your stomach get empty. Choose dry foods. Dry crackers or toast can help alleviate morning sickness. Stay hydrated. Sip water throughout the day. Ding! Avoiding large amounts with meals. Ginger and vitamin B6 may help reduce nausea. Consult your doctor before using supplements. Rest. Take time to rest whenever possible. 3. Proper nutrition. No need to eat for 2. In the first trimester, energy needs barely change. Only a slight increase of approximately 300 kcal a day is needed in later months. The focus should be on sufficient nutrients, easy digestion, and variety. Foods to avoid: raw meat, raw seafood, unpasteurized soft cheeses like brie, camembert, runny eggs, and high-mercury fish. Limit herbs that may stimulate uterine contractions, such as high doses of pennywort, rau ngat, or Vietnamese coriander, rau rum. Prioritize dark leafy greens, spinach, Malabar spinach, rich in natural folate, protein from lean meat, eggs, tofu, and low-sugar fruits. 3. The second trimester, months 3 to 6. The phase of relaxation and enjoyment. Discomfort usually subsides, making this the most comfortable phase of pregnancy. 1. Maintaining healthy weight gain. Weight gain goal. The ideal total weight gain for the entire pregnancy is 10 to 12 kilos for women with a normal pre-pregnancy BMI. Monitoring. Aim to gain about 0.5 kilos a week during this period. Gaining too much or too little weight requires close monitoring. Balanced diet. Focus on providing enough protein, calcium, and DHA, omega-3, to support fetal brain and eye development. 2. Physical activity and exercise. Gentle exercise, moderate physical activity, such as walking, prenatal yoga, or swimming helps boost health, improve blood circulation, and reduce back pain. Consult a doctor. Always ask your doctor about exercises appropriate for your health condition. Avoid contact sports or activities with a risk of falling. 3. Essential screening, fetal morphology ultrasound, usually at weeks 20 to 24. This is a critical ultrasound milestone to check the detailed structure of fetal organs and detect congenital anomalies. Gestational diabetes test, usually performed around weeks 24-28. Early detection and control of gestational diabetes are essential. IV, the third trimester, months 7 to 9. Preparing for the arrival. This is the phase of acceleration and physical and mental preparation for childbirth. 1. Coping with late pregnancy. Discomfort, swelling, edema. Elevate your legs when resting and massage gently. Avoid standing or sitting for too long. Heartburn. Eat slowly and divide your meals into even smaller portions. Avoid spicy, acidic, or greasy foods. Insomnia. Sleep on your left side to improve blood circulation. Use a pregnancy pillow to support your abdomen and back. 2. Acquiring knowledge and skills. Prenatal classes. Attend classes on labor, newborn care, and breastfeeding. This is an excellent way to alleviate anxiety. Create a birth plan. Discuss delivery options, vaginal, C-section, with your doctor and make a detailed plan for your labor day. Prepare supplies. List and purchase essential items for mother and baby. 3. Mental health. Avoid stress. Anxiety is natural, but find ways to reduce stress. Share your feelings with your partner, family, or friends. Relax. The most valuable advice from experienced mothers is relax and trust your body. You don't need to control everything. Enjoy the final moments of your pregnancy. Other practical tips. 1. Folk beliefs versus science. Filter information. Many traditional taboos, like avoiding haircuts or funerals, lack scientific basis. Prioritize advice from your obstetrician and credible medical sources. 2. Oral health. Special care. Pregnant women are prone to gum inflammation due to hormonal changes. Brush and floss regularly and have regular dental checkups. 3. Safe sexual activity. Intercourse is possible unless your doctor advises otherwise, e.g., threatened miscarriage, placenta previa. Sexual activity during pregnancy is safe. Conclusion. The journey to first-time motherhood is a monumental change. Remember that every pregnancy is unique. The most important things are regular prenatal visits, balanced nutrition, adequate rest, and maintaining a comfortable state of mind. Trust your body and do not hesitate to ask your doctor about anything that concerns you. We wish you a safe and happy pregnancy.